A follow-up question from Twitter for you, Dr. Goodman. What are examples of what the state of Maryland has done in the past and is doing to build those better systems of prevention?
Well, we actually, and we've actually come from far behind, but one of the big systems that we're truly working on is our school-based dental sealant programs. We really feel, first of all, dental sealants along with community water fluoridation are the two evidence-based prevention strategies that is obviously known. And while the state has done incredibly well in terms of our community water fluoridation, we really have been lax in our school sealant projects, and that's because for many years we didn't have a state oral health program to sort of develop a focus for such a statewide initiative, so they were done almost just on a local level. But now we're coordinating and coalescing all those activities and truly promoting the provision of sealants in schools. We also, something kind of lost, I guess, in today's discussion, is that we developed a public health hygienist category as a result of the Dental Action Committee recommendations, and our health departments and federally qualified health centers and other public health entities are increasingly using this very critical workforce to provide preventive services in schools, in Head Start programs, WIC programs, and the like. And we can only continue to increase those critical efforts, and that's what our plan is right now in terms of prevention.
Thank you, Dr. Goodman. Our next question was submitted from an employee at a community health center, and I think Rear Admiral Bailey, you'd be appropriate for this question. I work in a community health center. Can you give me some direction on where we can find some oral health literacy materials to educate our patients, many of whom come only for emergencies and not for preventive care?
Yes, a broad array of oral health literacy materials have been developed. CDC has resources. HRSA has resources. Indian Health Service has resources. Maybe we can make those available somehow, but there are a number of tools and resources related to health literacy. You know, for the federal government, there's something called the Plain Language Act that requires the federal government employees that are putting out any regulations and so forth to write in plain language. Something that's encouraging is for the first time ever this year, the IOM Roundtable on Health Literacy held the first ever day-long workshop on oral health literacy. So there is greater emphasis on oral health literacy. There are lots and lots of resources. I'm not sure how we can make those available, but we can certainly explore the avenues, but there are many, many out there, and you can just look at some of the HHS websites, CDC, HRSA, and so forth, and you'll find lots of materials on health literacy.
This is Howard Koh. I can also add that Dr. Seiji Hayashi at HRSA has leadership in many of these oral health outreach and education and health literacy themes. So if you want a main contact person at HRSA, I'm going to put his name forward here.
And this is Harry Goodman, and I want to reiterate driving people to our own website, which is healthyteethhealthykids.org. And also, we have in our own backyard one of the foremost experts in oral health literacy, in Dr. Alice Horowitz, who's now at the University of Maryland at College Park School of Public Health.
Thank you. Dr. Goodman, a very specific question from one of our listeners. Where can we find the locations of the 5 public health clinics in Maryland?
The new public health clinics were in areas that were previously noted to have no public health facilities whatsoever. So they are really in 5 different counties. I can name them if you want, but those are counties that when we first started our reforms, we basically did an environmental scan of all the jurisdictions in the state, and these were found to have absolutely no public health resource, that being not a FQHC or a local health department. And so we've been able now to basically fund through state funding and through other resources as well, programs in those particular 5 clinics, 5 jurisdictions. I will say that they are a combination of rural and suburban counties. Well, actually, one is actually a rural county, but they really span the type of populations that live there.
Thank you, Dr. Goodman. Rear Admiral Bailey, I think the next question would be for you, and I think you touched on this in one of your previous answers. Why is it important for everyone in different areas of healthcare to be concerned about oral health, such as medicine, dentistry, and pharmacy?
Well, not everybody accesses care from their dentist, and we heard on the call earlier that over 100 million people don't have dental insurance coverage. So people are going to other types of providers, and those other types of providers can help to integrate oral health into primary health care. There are groups now that are teaching other types of providers to conduct an assessment and to alert patients of their oral health needs, to try to refer them to the proper care that they need. But by doing this, they can also consider oral health conditions when they assess the patient's overall health. They can also assist in being willing to deliver oral health preventive interventions. And this increased partnering helps to integrate health across all disciplines. There are some medications that cause things such as gingival hyperplasia and xerostomia, which is dry mouth. Xerostomia puts people at a higher risk for tooth decay, and there are a number of types of medicines such as antihypertensives and antidepressants and antihistamines and so forth that can cause a person to have dry mouth. So it's important for other types of professionals to know about oral health, and in fact, some initiatives have been launched by other types of professionals. There's a national interprofessional initiative for oral health that is being driven by physicians and physician assistants and nurses and pharmacists about oral health to make sure people are more informed about oral health issues, and they've developed a Smiles for Life curriculum, which is a nice curriculum that can be accessed by the internet. Yeah, that's good.
Thank you, Dr. Bailey. Another question for you, Dr. Goodman. Has Maryland's Office on Oral Health worked with the Maryland Dental Action Coalition on any school-based intervention? If so, how were the schools and communities engaged?
Well, we're just getting going in that. Of course, as part of our state oral health plan, we have worked to basically include that as a very critical part of our work with the MDAC. But we did work with them to actually help co-write a proposal to the Kaiser Foundation. They received a pilot school screening grant, and which they're currently in the middle of right now, to try to test efficiencies in terms of basically providing care coordination, case management to kids who are screened in schools, and then, if needed, referred to the dental home. And they're sort of piloting that connection point between the screening and then the actual receipt of any needed follow-up care. So we've been pretty active on that. As I said earlier, we're only going to continue to do more in this particular area. It's a really big emphasis for us.